Knowing the visual fields of the patient is again very important. Usually we divide or we use the terminologies of superior, inferior, nasal, midline, or the lateral or the temporal visual fields that are affected. Sometimes the peripheral vision is affected of the patient, and sometimes the central vision is affected for this particular patient that we're talking about. So there are basically a range of abnormalities that can relate to these particular visual fields when we talk about them. So after we have inspected the patient, the step-by-step examination of the eye includes the inspection of the eyeball, and then we're going to move on to the visual acuity. We're going to move on to the extraocular movements of the eye. We are done with the accommodation and checking out the convergence ability of the eye of that particular patient that we're examining on. Then we're going to carry out the tests for the visual fields on that particular patient that we're going to talk about. The techniques that are usually devised for the determination of the visual fields in a particular patient, that is going to be discussed over here. And then we're going to move on to the clinical assessment of the patient as well. And then we're going to move on to the pupillary responses. So what are the different sorts of the pupillary responses? It can be the dilatation of the pupil, it can be the constriction of the pupil, and then it can be the flashlight test or the swinging light test that are performed on the eyeballs of the patient. And then we're going to detect the different abnormalities that can be seen in the patient as well. So ask the patient to cover one eye. This is the mainstay over here. What we're going to see over here, you're going to basically ask the patient to cover one eye, cover your opposite eye, and ask the patient to look straight ahead. So this is the method that is being carried out even over here. You're going to make the patient cover the eye, you're going to cover your eye, your opposite eye, and you're going to ask the patient to look straight ahead. First of all, place one hand in plane between the patient and examiner out of your vision. Move the hand and ask the patient when he or she can see your hand. So you're going to start off most laterally, and then you're going to make the patient, you're going to ask the patient, he or she is going to tell you when he started seeing that hand. It should be at the same level. You're going to basically compare your visual field with the visual field of the patient. When you start seeing the hand, the patient should also start seeing the hand. So this is the technique over here that is usually devised for the determination of the visual field. If it is normal, the comparative study is present. As an examiner, you're going to compare your visual field with the visual field of the patient. This is the technique for the conductance of the visual field. And then the different techniques are: both the eyes are checked out, stimulation simultaneously, place the hand in the lateral field for both the eyes, ask the patient to note which hand is moving, at some point move both the hands. So this is the mainstay over here. How are you gonna see this particular kind of the visual field effect in this patient? Each of the examiner's hand are visible by only one of the patient's eye. If he can only see one hand moving, when both hands moving, small defect in the occipital cortex. If he can see only one hand moving, when both hands are moving, so you as an observer can see both the hands moving, but the patient can only detect one movement of the hand. That means that there is some small defect in the occipital lobe. The brain signals are basically affected in this case, and usually the center of the brain that is involved in detecting this brain signals is the occipital lobe of the person. So usually if the visual fields are defective, the occipital lobe is the criteria that we're talking about over here. Then we have the eyes pupillary responses that are clearly seen over here. The pupillary response to the light is seen. Direct same eye light is directed into And then we have the pupillary responses that are indirect. The eye light is not directed into watch the examiner's eyes closely and can watch the eye dilate in this section as well. Then we have the swinging flashlight test over here, and that is sometimes performed, and that is basically start in one eye, quickly move to the other eye and wait, then fast back to the original eye and wait. So these are the three primary tests that are performed for the examination of the eye pupillary responses, ranging from the pupillary responses to the eye, the indirect pupillary responses to the eye, that is the eye light is not directed into, and then we have the swinging flashlight test that is performed for the examination of the pupillary responses in that particular patient that we're talking about. So what makes this pupil dilate or constrict when this through this light reflex? We have this consensual light reflex, and you can see that the nerve involved in this consensual light reflex is the third cranial nerve, which is the cranial nerve 3, and then we have the second cranial nerve over here. The optic chiasma is the place where the basically the fibers from the right are circumflating to the left, and that is why if there is a defect in the consensual light reflex on the right side, the cranial nerve involved is usually on the left side. So this is what you're gonna focus on over here. The efferent nerve constrict the pupil of the same eye, and then we have the third cranial nerve that is over here. We have the afferent fibers that are going from the eyeball towards the midbrain or towards the occipital lobe for the interpretation. So this is basically the direct light reflex. The efferent nerves constrict the pupil of the same eye, and then we have the consensual light reflex when the torch is basically placed over here, but it constricts the pupil of the opposite eye. So this is the difference between the consensual light reflex and then we have the direct light reflex on the other hand. So when we talk about this pupillary light responses, they observe the reflection of the pen light in both pupils. Is it symmetrical or not? They test the pupillary responses to the light, also the direct pupillary responses and also the consensual light responses. Pupils constrict in the examined eye, and the consensual eye responses, the pupils constrict in the opposite eye. So these are the responses that you're going to examine. Then we have the swinging flashlight test that is performed, in which you basically throw the light on one of the pupils, and then you swing the torch and move the source of light to the other eye. So it detects the optic nerve versus the ocular disease. A bright light is placed in front of one eye, it is moved quickly to the other eye, and then 1 or 2 seconds later it is moved back quickly to the first eye. And what happens over here is that the pupils should be constricted when the light is taken from one eye to the other. So this is the swinging light reflex that is usually performed in the patient, and is for the differentiation of the ocular diseases from the optic nerve diseases that are usually present. Through this pupillary responses, we can have a look, or we can differentiate between these two groups of diseases. So in this section, basically, we focused on the pupillary eye responses and how are we going to conduct different tests to demonstrate these abnormalities. So that is the end of this section. Thank you for watching sqadia.com.